Carpal tunnel syndrome, okay? Put my hand up like this, or we can put it this way. See how those three fingers make the letter M, sorta? That would be the median nerve. And that's a nerve that is typically affected for carpal tunnel syndrome. Hi, I'm Dr. Peters with Peters Wellness Chiropractic Massage. In this week's video, I want to discuss carpal tunnel syndrome, aka CTS. And there's some differential diagnoses, and you'll see I've got some other posts out there this week talking about ulnar tunnel syndrome and different issues that can be happening in the neck or the shoulder or elbow, which can cause or mimic symptoms of carpal tunnel syndrome. So once again, to look at the carpal tunnel syndrome, we're talking about median nerve distribution. So all of our nerves start in our brain, have to travel through our neck and then out to their distribution points. And they're gonna come out through these little holes between the vertebrae, whether it's in the cervical spine, the thoracic spine, or the low back area. So for the median nerve, it's gonna travel out. The main, I don't wanna get into too much detail, but basically it's C6 and C7. So cervical, you have C0, which is your occiput or the base of your skull, and then C1 or the atlas, and then C2, C3, C4, C5, C6, C7. So that area is gonna be right down here in the lower neck, and it's gonna travel out, travel down through the arm, come out through here. Let's see if you can see that. You're gonna come down here, and it's gonna come through the tunnel. So the carpal tunnel is made up of 8 bones, 2 rows of 4, and then you have the radius and the ulnar. And then you got that nerve that comes through there, and there's some tendons that wrap around there. And when people have carpal tunnel surgery, one of the things they'll do is they'll go through and they'll cut one of those tendons to open up the pressure. So if you're gonna have that done, we really wanna make sure that's what's going on. So the nerve root distribution of the median nerve is going to be your thumb, your index, and your middle finger. So that's going to be these 3 here. And so just kind of thinking of it like this. And again, the way I remember median nerve when we were in school was when you flip it over, this makes an M for median. These 2, if you have distribution here, that's the ulnar nerve. Now there is some overlap, but again, the median nerve is here. So if you're having symptoms here, it's unlikely to be carpal tunnel syndrome. If you're having symptoms here, it is more likely. And when I say symptoms, I'm talking numbness and tingling, or even atrophy of the muscles where you can see, like if you held your hand up, you're like, wow, the muscles in my hand, I can see they're getting smaller. My hand looks funny. That would be very, very bad and should be looked at immediately. Or even if you're having numbness and tingling, because when you look at that distribution, now if you're typing a lot and doing things like that, you know, you're putting your wrist up into extension, or you have it in flexion a lot, if your ergonomics aren't well, then you got to think of where your elbows are and where your shoulders are. So if I'm, excuse me, get this chair out of my way. So if I'm sitting there and if I'm typing and I got my hands up here, obviously that's going to cause a lot of stress and strain. So if I got my hands down, like I got them right on top of my desk right now, and I'm nice and relaxed through the shoulders and I'm typing, man, that's going to be a much, much better situation. But you got to look at the elbow because it could get entrapped in through here, or at the clavicle, or the collarbone, or at the neck. So when patients come into the office, we're going to look at all these areas, right? I mean, there could also be a space occupying lesion somewhere in the spine that be causing it, but that's way down the road. That would be something, would not be our first concern. But if someone's not getting better under regular care, we need to start thinking about some of these other possible more serious conditions. So I'm not trying to say carpal tunnel syndrome is not serious, but if you have entrapment of a nerve here versus some kind of lesion in your brain, there is a big difference of severity there. So if you have questions on this, I'd love for you to post any questions you have. Either on the YouTube or on Google or on Facebook or wherever you're seeing this, Instagram, and get the conversation going, because people get very confused on this issue. And, you know, thank God for Google, because you can look up so many things. And I've been making some posts. I've scheduled a few posts that'll go out this week talking about carpal tunnel, showing pictures of it, because truly pictures are worth 1,000 words, and if not more. And when you look at those and start to understand it, that way you can ask better questions, because with all the typing and everything we do, carpal tunnel is like, yeah, I've got carpal tunnel syndrome. But you start asking questions and people really don't even know, or people who've had carpal tunnel surgery who are still having symptoms. I mean, can you imagine going through a surgery, come out and going, I've still got the same symptoms? Somebody missed something. So why not have it looked at? Manual type therapy, physical therapy, chiropractic care, acupuncture, the different things that can be done, and making sure that you're looking at it in a progressive nature so that you can take care of it with the least invasive techniques to help you feel better. So I hope you have an awesome week. Go ahead and ask any questions you might have. I'd love to help you with this issue.